President Trump left Walter Reed Medical Center Monday evening. He was admitted Friday after testing positive for COVID-19. After 3 days of what's considered aggressive treatment, Mr. Trump's medical team says he has improved enough to return to the White House. In a tweet, the president urged Americans not to be afraid of the coronavirus, writing, quote, "We have developed some really great drugs and knowledge." He claims he feels better than he did 20 years ago. Dr. Bob Wachter joins me now. He's a professor and chair of UC San Francisco's Department of Medicine. Doctor, thank you very much for being with us. The president was admitted Friday to Walter Reed just 3 days ago. What does his release suggest to us about his condition? And is there still cause for concern?
Well, his release suggests that he has been doing okay, which is what we've been hearing from his doctors. The information we've gotten is a little bit unreliable and seems to change, but if we are to believe it, he's doing okay, he looked okay. So that's all great. It does seem a little bit premature because he is not out of the woods. One of the things that happens with COVID is sometimes people do fine for a few days and then get very, very ill. So he still has another 5 to 7 days before he's out of the woods.
Yeah, I mean, how long typically is a coronavirus patient contagious?
Well, they're contagious for about 10 days after their symptoms started. And so one has to assume that he is still contagious today and will be contagious for another week. So he needs to be in strict isolation with only people coming in contact with him who have essentially full PPE, and he should not be wandering around the White House. It was a little concerning today to see him get to the White House and take his mask off and walk into the residence. We can assume now that he is still contagious.
Yeah, and what will the care for Mr. Trump actually look like now that he has left the hospital?
Well, the medicines he's on can be given in the White House. He has one more day of the antiviral drug remdesivir. That's an IV drug, so he'll get that IV in the White House. That's certainly doable. He should have about 5 or 6 more days of the steroid medicine, dexamethasone. He get that either IV or orally. He's done with the experimental medicine, the antibodies. So he'll complete those medications. The most important thing they'll be doing is monitoring him. His oxygen level, his breathing, his mental status, all of those things need to be monitored very carefully because COVID patients can sometimes do just fine. And then an hour later, they're very short of breath. And we've certainly seen people who've needed to go to the ICU acutely, which is why I think on average, we would have kept a patient like him who's at still pretty high risk in the hospital. I'd rather be 100 feet away from the intensive care unit than a helicopter ride away.
And doctor, you mentioned dexamethasone, that steroid being given to President Trump. Are there any notable side effects? And typically, what is that kind of powerful steroid in the case of a COVID-19 patient used for?
It's used to tamp down the immune system, which can seem counterintuitive to people until you understand what's going on with COVID. COVID strikes you. The virus burrows into your nose or your mouth and then takes hold of your cells, and in a bad case will go down into your lungs. So your first several days, the reason you feel sick is the virus doing its damage. Then after that, your body's immune system tries its darndest to attack the virus. And in doing that, it can cause its own damage. And so what we believe from the science is that after the first 5 to 7 days, much of the damage from COVID, and in fact, the deaths from COVID are often not from the virus itself, but from this overexuberant immune response. So dexamethasone is designed to tamp that down. We try to not give it for the first few days. The evidence is that it tends to work better if you wait a little while, which has made it a little bit surprising that they started it so early. And the evidence is quite clear that patients who get it, who are not very sick, so if you're not needing oxygen and you get it, those patients tend to do a little bit worse. The benefit is seen mostly in patients who are quite sick, particularly patients who need a lot of oxygen. So I'm sure there was a lot of internal debate among his physicians about whether to give it to him. The side effects we worry about, it suppresses your immune system, so it puts you at risk of other infections. The one in Mr. Trump's case that I'm particularly worried about is it can mask some symptoms. It can make your fever go away. It can make your muscles stop hurting. Can make you feel 20 years younger, which is what he said. But it can also cause subtle and sometimes non-subtle changes in your thinking. So we certainly have seen people who've been confused, who have been euphoric, who have been agitated, and who have even been a little bit manic. And so that, of course, raises some concerns for the leader of the free world.
Right, and something that we'll continue to ask questions about as reporters. So the president, we saw, Doctor, took part in a motorcade this weekend to thank his supporters. You called the move, quote, massively irresponsible. There were two others in the car wearing masks. Can you explain why you believe this was a risky move?
Yeah, not so much risky for him. I think if he was sitting on the floor, in his room in the hospital and his oxygen level was fine, he was breathing fine, his vital signs were fine, getting out and taking a stroll and taking a car ride around the block, I don't think poses any significant risk to him. The risk is that, as I said, he is contagious. And we generally feel like he should be limiting his exposure only to people who have an absolutely essential need to be with him. And so for a doctor or nurse to come in and see him in his hospital room is one thing. For this ride to go around with multiple Secret Service agents in the van, even if they're wearing full PPE, I think it struck most of us in the medical community as being imprudent. The Secret Service agents take a vow, of course, to protect him, but they don't take a vow to protect themselves from him, which is essentially what we were talking about.
And I wonder, Doctor, if you could weigh in on, the president's doctors have also been criticized for allowing him to leave the hospital and take that drive-by past his supporters. Is it clear what their role was in all of this? In your opinion, should they have somehow tried to stop the president? And is that something they could even do?
Well, they can't tackle him, and they can't shackle him to the bed. And their job is to give him the facts and make sure he's making an informed decision. He has a right to do that, assuming that his thinking is clear. I mean, we certainly have patients who want to leave the hospital, and we don't let them go because they're too confused and they can harm themselves. So that, of course, is the question. My sense is that they did believe that he was competent, his judgment was intact, and he was making a decision that he wanted to make, in which case their obligation is just to be sure that he has all the facts and knows what the consequences might be of his action, whether it was the ride around the block or leaving the hospital potentially prematurely.
And Doctor, before we let you go, it's been suggested by one of the members of the president's medical team that the need to give this positive message early on when the president was first brought to Walter Reed was in part sort of deliberately to give the sense to the patient, in this case the president, that there was sort of hopeful news so as to positively perhaps impact the outlook, the actual medical outlook for the patient. I'm just wondering, in your opinion, can you talk to me a little bit about that balance that you try to strike as a physician when delivering what is undoubtedly very difficult news when you have a serious diagnosis like COVID-19? We know there can be a constellation of complications and problems and uncertainties associated with that. What do you make of this idea of trying to present a positive message so as to positively influence the actual physical health of your patient?
Well, it's a common situation we find ourselves in. And I think, all of us as physicians try to speak to our patients truthfully, give them the facts, but also don't take away hope. And so it's not unreasonable in the one-on-one doctor-patient relationship to say, here's this disease and it could be pretty bad. In this case with COVID, there's a decent chance he will do okay, and then there is a reasonable chance that he's not going to do okay. So to give the patient sort of tilted a little bit toward, we're hopeful, we're optimistic, we're going to do everything you can, you're in a great place, that's all fine. The tricky part here is his physicians really have two very distinct roles. And one is their relationship with the patient, who in this case also happens to be their commander-in-chief. So that's already a little bit strange. But also, when the doctor strolls out to the podium wearing his white coat, he's no longer really acting as the patient's physician. He's acting as a communicator to everybody in the country, and in fact, everybody in the world, about the status of a world leader. And at that point, I think the spin needs to end, and I think it's important that we get the unvarnished truth. And what I heard over the last 3 days makes me somewhat concerned that we tended to hear a lot about all the good news. And when there were things that might be a little bit more negative, they were either glossed over or, in fact, withheld.
All right, Dr. Wachter. Doctor, thank you very much for sharing your perspective with us. Really appreciate it.
Thank you.